Good evening, everybody. My name is Ingrid Tanner, and I did my presentation on the audiologist. The audiologist is a healthcare professional. They deal with identifying, diagnosing, treating, and monitoring disorders related to the auditory and vestibular systems of the ear. Some ordinary cases they deal with are older adults, which may be experiencing loss of hearing, or others which have balance disorders specifically. Tools they use regularly are computers, audiometers, and the otoscope. The otoscope is the tool most frequently used to check the ear canal and the eardrum. Daily clientele range between 6 and 9 individuals, between 30 to 60 minutes each schedule. This is dependent on what kind of appointment they have scheduled. Either an ear examination or just a tune-up on their hearing aids. Most of the day is spent in a chair or just seated in general. Sometimes they may get up to perform examinations and do other administrative duties, but mainly seated. The work environment. The average work week is 40 to 50 hours. This is in a room which is temperature regulated, usually quiet due to the nature of the job, very orderly, and the main stressor that they encounter is a psychological reason due to the reason some may come. It is a sensitive topic for some to talk about hearing loss as they age, or it might be hard to talk to parents which their child has hearing disabilities and may need to have certain operations or apparatuses to deal with that. So these kind of stressors are emotionally driven and take their time, take their toll over time. The particular of the worker. There are no specific anthropometric requirements for this occupation. They usually work in hospitals, physicians' offices, audiologist clinics, and sometimes in schools. Some audiologists will travel between facilities, whether it's between schools and their clinics or the hospital and their clinics. The general age range is 25 years and older. This is due to the reason that it is a doctoral degree requirement to enter the profession, which takes an extra 3 years after getting your bachelor's. Injuries that you will see in audiologist clinics are mainly observed in the upper extremities and may be due to repetitive stress injuries and holding static positions. Prolonged sitting is the main culprit. Spending hours seated with a flexed spine leaves the audiologist with chronic back pain. Chronic exposure to this flexed spine may result in herniated discs, osteophysites, or bone spurs. At the desk, they have contact stress on the desk and potentially the mouse pad and the keyboard. This results in carpal tunnel syndrome or other tendinitis. They may be feeling tingling, numbness, or other sensations similar to this in the region of the wrist and hand. During ear examinations, they tend to lift their arms to the side, also lifting their shoulders up and bringing their hands in a crouched position to view into the ear. And depending on the client, they will have to either look up or bend down, especially when they are placed on a table. This again is putting a lot of force and stress on the upper shoulders, and elbows can resulting in pain and bursitis. Some elbow epicondylitis has been noted. Also, the bending over to do the examination puts a lot of force on their lower back, which increases the potential of having the risk of lower back pain. During the workplace assessment, one would see around 15 to 20 staff at an average clinic. Obviously, this changes depending on the size of the clinic and the location. If it's in a hospital, you might have over hundreds, but it's not specific for that area. The injury and illness prevention program on site was more of a guide to prevent the risk of illness and injuries at work. And since it was a health-related clinic, most employees were well aware of the health-related musculoskeletal disorders that can occur with improper posture or movement during work. So a lot of times they understood that they should get up and move about, or they should try to keep their back straight and not hunch. And they were very aware of different things they can do to help with pain, such as exercise after work. But no one really talked about maybe doing stretches or exercise at work, or a program that might help with that disorder or problem. Some preventative measures that I thought about were for engineering controls were replacing ordering desks with the adjustable standing desk. This leaving the audiologist able to stand sometime during their desk operations. This would reduce the stress on their back. Also, it will take them out of that hypolordotic posture or flat lower back. Adjustable tables for when they do ear examinations. This means they could lift or lower depending on the patient. They wouldn't have to hunch over when seeing any kind of patient just because they're on a lower table. This is going to reduce the excessive hunching and spine flexion and reduce back pain over time. Also, they could purchase more ergonomically friendly examination tools, such as the one in this picture. She is using a digital otoscopy to look into the ear canal and see the child's ear without hunching, straight posture. Another thing for the administrative controls, I believe that having a 5-minute stand and stretch hourly is much better than having a break every 4 hours. This will help with circulation and removing people from a static position, lowering the risk of chronic back pain or other issues with their upper extremities. Also, adjusting schedule according to task, potentially having a standing task 1 hour, a seated task the following hour, and so on. This is also going to decrease the repetitive motions and prolonged static positions that they tend to do over and over and every week, and which would add up and potentially cause all those injuries listed previously. So that was the occupation, and for the end I have a little ergonomic humor. In this picture is written, "Management doesn't want us to call it coffee. They prefer to term it ergonomic water." I thought that was funny. So thank you for enjoying my presentation. And this is my first YouTube PowerPoint presentation, and I hope to make more in the future. Thank you.